Talking about hemorrhoids is interesting. So let's go to causes and risk factors. I know it's a very sensitive topic, so I'm sorry for that. Increased pressure in the anal and rectal veins, such as straining during bowel movements, often due to constipation, pregnancy, chronic diarrhea, or even obesity, can contribute to hemorrhoids. Age Hemorrhoids become common in old age people during old age, as the tissue supporting the veins around the rectal area and the anal area tend to weaken with age. If you're talking about diet, if you're taking food low in fiber, you're likely to constipate. That will bring about a straining during bowel movement that will increase the risk of getting hemorrhoids. Prolonged sittings during bowel movements, spending long periods in the bathroom can really increase your risk of getting hemorrhoids, again due to the pressure that you will have inserted in in the tissues and the veins around the rectal and anal area. So hemorrhoids present hemorrhoids present with different symptoms, both external and internal hemorrhoids. They are into two categories. I've talked about two categories of hemorrhoids. There is the external ones that is around the anal area, and the internal ones around the lower rectal area, lower rectum. Yes. So the hemorrhoids around the anal areas can present with itchiness, pain, swelling around the anal area, or even they can develop some blood clots around the anal area. The internal ones can present with rectal bleeding that is painless. And there is that one person or two who are having the mixed types. Now the internal ones and the external ones. So let's also begin. You will present with both symptoms for external and internal hemorrhoids. You know there are home remedies. The home remedies include you sitting on warm water, warm baths, and also using over the counter medication like ointments and some creams, and also increasing your intake of fiber slowly by slowly. While you are encouraged to increase your fiber intake, again you should start slow, gradually increase your fiber on your daily intake. Thank you. Let's go to prevention. Now, remember, after the two episodes elapses, you can focus and embark on prevention of hemorrhoids reoccurring or reappearing. So, focus on your diet. Which I've talked about, increasing your fiber intake, that includes soluble and insoluble fiber intake. Include or incorporate some fruits and vegetables, if possible whole grains in your diet, as this will lower your chances of constipating, hence reducing the chances of you having hemorrhoids. As you focus on your diet, please do not forget drinking plenty of fluids. Yes, fluids. There is the percentage of water that you should be taking, and the other percentage you can fill with fluids like fresh made juices, and also smoothies from home. I don't know, whatever works for you. Another thing is avoid straining during bowel movement by ensuring that you go to the bathroom when you feel the urge to. Do not go if you've not had the urge to go to the bathroom for bowel movement, to go, do not go sit and wait for bowel movement. Again, do not sit and wait after you felt the urge. If you feel the urge, please go for bowel movement. Exercise regularly, as this will also help prevent constipation, hence preventing hemorrhoids. Again, hapo kwa diet, kindly know what kind of fiber works for you and the sources of fiber that works for you, the fruits that will work for you again, so that you don't take a fruit that is contributing to constipation. If you are having acid reflux, please avoid citric fruits. Please embark on fruits that do not have citrus in them, acid in them, so that you do not again accelerate the acid reflux thing that will bring about constipation. So focus on healthy fruits for you. Remember, diet is personalized just as health is personalized. Whatever you are allergic to, whatever you are having intolerance with, is not what I'm having intolerance with, is not what another person is having intolerance with. So just listen to your body, whatever works for you, kindly focus on it. But there is the general knowledge of avoiding processed sugar, focusing on fermented foods, and even mala. Mala is good. Remember, whatever blesses your gut, blesses your bowel movement, and you will have reduced hemorrhoids chances or reappearance by a bigger percentage. Diet is everything. Remember, over the counter medication again is not cheap. You cannot be budgeting for your food and budget for your medication, while you can still budget on a good diet that will keep you off medication. Thank you and adios. See you. Mwah.